So ovarian cancer is a relatively common problem, and we don't fully understand what causes it. What we do understand, however, is that there are a number of risk factors that may be related to lifestyle and other things, which may be preventable. However, the majority of ovarian cancer problems are probably due to genetic causes that are things that we can't necessarily influence. So there are a number of recognized risk factors, but there are also an awful lot of factors that we don't fully understand at the moment. Of the recognized risk factors, we identify that women who have no children are at risk, women who don't breastfeed are at risk, women who are not on the pill are all at increased risk. And we think the link between all of these factors is ovulation and the number of ovulatory cycles that you have. That's when you release an egg from the ovary. So the common strand with all of these factors is if you have children and breastfeed and are on the pill, you're actually reducing the number of times that an egg is released from the ovary. And it's possible, or what we believe is the disruption to the surface of the ovary when you ovulate increases the risk of damage to the surface of the ovary that may then increase the risk of cancer. So these are factors that we picked up through studies where we've taken histories from many hundreds of thousands of women and compared those women who develop cancer with those that haven't. It's a particular form of research. We know that there is a link with HRT, so there is an increased risk of ovarian cancer in women on HRT. And in terms of protective factors, we know, as I said, that being on the pill for up to 5 years, over 5 years of use is helpful in protecting. We also know that breastfeeding and having more children is a protective factor. So ovarian cancer is commonly diagnosed through fairly simple tests of a blood test, the CA-125 and an ultrasound. But those tests are usually not necessarily thought of and performed in a timely manner. So ovarian cancer can be treated in general in one of two ways, and often women need both forms of treatment. So for women where it's deemed that we can remove all the ovarian cancer, we would aim to operate on them. Where the disease is quite widespread and in a place where we can't surgically debulk that disease, we would often treat first with chemotherapy with a view to operating at an interval. So the choice of surgery first or chemotherapy first very much depends on the pattern of spread of disease, general information about the fitness of the patient and their ability to withstand an operation. So they are the main factors that determine whether we operate first or give chemotherapy. So the majority of patients with ovarian cancer will be offered surgery at some point in their journey. As I said, if we feel we can remove all the disease at presentation through an operation, even though it may have spread beyond the ovaries, if it's confined to the abdominal cavity, then we would try and operate if we could.